All right, welcome back to Daybreak. It's now 4 minutes to 7 o'clock. Before we speak to the Principal Secretary for Health, that is Susan Mochache, I want us to take a look at some of the things that we know in as far as the situation in the education sector is concerned. I want us to take a look at some of the graphics that we have that this morning we know for sure that in as far as the schools are concerned, there is a committee that was appointed by the Cabinet Secretary for Education. The committee is called the National COVID-19 Education Response Committee. In their work, it has a 9-point terms of reference, but in some, this is what they're supposed to do. They are supposed to advise, to review and advise on how to reorganize the school calendar, bearing in mind that the closure has affected the schools since the 16th of March. Then they're also supposed to advise on the fate of boarding schools, bearing in mind that at boarding schools, social distancing may be difficult. The learners are all inside a school, the institution. At the same time, sometimes the teachers will live inside the schools, others who may live outside the school. They're also supposed to advise on how the poor are going to continue accessing the education during the times of COVID-19. Then they're also supposed to advise on the health and safety measures for schools that are supposed to be adopted, obviously because of the coronavirus disease. And then after that, something else that we know for sure is that they are looking at how to be in a position to advise on the health measures that are to be taken by schools, including the hand washing. You know for sure that some schools do not have access to clean running water for washing the hands, the soaps as well. They are to advise on what should happen to hand sanitizers, the masks for learners, bearing in mind that so far in the country it is illegal to go into the public without a mask. They are to advise on social distancing, that like how many learners are supposed to be in a class. Can the learners study in shifts? Where, for instance, you said that Monday and Tuesday to be grade 1 to 5, so that you can also be in a position to have the learners occupying different classrooms. Could there be alternative learning channels? Could there be phased reopening? Could there be learners' transport means? What are they supposed to do? Because currently the public service vehicles are supposed to carry 60% of their capacity, so what should happen to school buses? Then when it still comes to social distancing, in some countries, the school assemblies have been cancelled because of the coronavirus. Sports and games have also gone down in as far as how many learners are able to participate in such. The school meetings for parents and teachers have also been suspended to keep the disease at bay. Other health and safety concerns include the safety of teachers, especially the teachers that are above 50 years or teachers that have pre-existing conditions. You know for sure that in the public service, the people that are above 58 years or have pre-existing conditions have been asked to work from home or take leave. So what is supposed to happen is that education stakeholders, being teachers, parents and schools, have until the 22nd of May to submit their memoranda to the committee to be in a position to decide on what should happen to the education calendar. So those submissions should be sent to the Secretariat of the National COVID-19 Education Response Committee, either via email, which is covid19erc@kicd.ac.ke, or P.O. Box. This is the Postal Services P.O. Box 30231. The postal code is 00100 Nairobi. So those are the addresses that you need to send your feedback to your memoranda. So what we know now is that the learners in the country, according to the census of 2019, we have nearly 18 million learners. 3.2 million of them are in pre-primary school, that is PP1, PP2. The primary school, we have 10 million, that is between standard 1 up to standard 8 or grade 1 up to standard 8. Secondary schools, we have 3.4 million learners. For TVET and colleges, that is technical vocational education training institutions, we have 506,000. For universities, it's 470,000. And all these people are now at home. And therefore, what that means is that they have to wait for a decision to be made when it comes to how they will be resuming school. So there are those that have written to the Cabinet Secretary indicating that they are dissatisfied with how the committee was constituted. They are saying that they would want to be put to be added, that is the Kenya National Union of Teachers as well as the WASU. So I'm told that now we need to cross over and speak to the Principal Secretary in charge of Health Affairs, that is Susan Mochache. Good morning, Madam, and how are you keeping this morning?
Good morning. Good morning. I'm well. I'm fine this morning, and thank you for having me on.
Right, and we are speaking about the state of the war, and we are looking at the numbers that so far we have, 887. Of course, if you are to look at this situation and compare it with the modeling that was earlier on, that had that the first week of April would have 1,000 cases, then it appears like we are in the first week of April now. What do you make of how the trend has been over the past few weeks?
When the modeling is done, there are some assumptions that are made. Mm-hmm. And the assumptions that were made earlier was really looking at how the disease would play out with minimal intervention. But of course, what has happened is that we have maintained the restrictions on the movement of people. We have caused cessation of movements within certain counties. We have continued to aggressively do contact tracing. And that has really played a big role to leading up to where we are now. Mm-hmm. And in fact, right now, the numbers we are seeing are exactly what a recent modeling projected, mm-hmm. that we will now start to see numbers going up to the 50s per day. Mm-hmm. And unless other important interventions, again, people continue to keep on to the restrictions that have been put, and the basic hygiene issues of washing hands and wearing masks and social distancing, then according to the projection, we will see a bit of this trend. Then the thing is to try and bring that curve quickly down. But as of now, this is very consistent with the model that we saw about 2-3 weeks ago. And what we actually did is that there were different models by different institutions, different people. And so we brought everybody together and we said, okay, put all the assumptions together as a team, pull together, put in all your thoughts, because what we also realized, sometimes the modeling is determined by what precisely somebody is looking for. A researcher is more keen on certain issues and makes certain assumptions. A case management person will be looking at something else. Mm-hmm. An epidemiologist will be looking at, how the curve is going to move and be stopped. So when we put all the teams together, really what is going on is very consistent with what they have done so far. Mm-hmm.
Maybe someone might want to understand, how do you do this modeling? What are these factors that you look at so that it becomes as credible as possible in terms of the outcome that you eventually see?
Well, it's a whole science by itself because there are many factors that they look at. They look at the population, they look at the spread, and that is informed by, at least for now, like Kenya, we have got a fairly good point to pick information in terms of how many people on average does one person, spread the disease. So we look at that. We look at the movement of people. We look at that movement. What does it say? So mm-hmm. there are several factors we look at. We also look at the population. Does it have comorbidities? And what does that mean? So, and comorbidities means that how well is the population? Mm-hmm. What is the percentage that is living with, say, HIV and AIDS? What is the percentage of people that are elderly? Mm-hmm. So they look at the demographics, they look at the state of health, and they also look at the intervention that are in place. Mm-hmm. So, and all this is, algorithms and mathematics. So there's a lot of data analysis. They also look at, for example, get mobile information, not on individuals, but mm-hmm. looking at how does the humanity of man, how are people moving from, say, Isili to Kawangware or Kawangware to Lavington, that movement, what does it say? Okay. So it's a whole science, but we are very proud that the work that is being done is by Kenyans, and it has received some recognition out there because it's all homegrown and working with partners who feed in, but it is largely driven by our own Kenyan epidemiologists and infectious disease control experts.
So when you look at the model that we are working with currently, where do you see us hitting the peak, and at how many cases would that be?
Again, it is not a perfect science, so it's important to say that, but right now what we are looking at is if we continue to be very diligent mm-hmm. and, really strictly adhere to all the guidelines, we see ourselves peaking around, October thereabout, and again, no exact science. If we all really, really come out very strongly and wear masks, which, for example, the government is currently trying to procure for the most vulnerable members of society, because we believe it is a very important prevention intervention. So if we get a lot of us wearing masks, if we get a lot of us also continuously washing our hands at every point and maintaining social distance, it could be sooner. But with the current behavior that we are seeing, that is what they project. But then again, not a perfect science, but so far what we are seeing is consistent with what the recent projections have looked like. But I must also say that our behavior is worrying. The fact that we are beginning to, go back to normal business, the fact that we are beginning to look like we are oblivious to corona, that is a concern, and that may pull us back. We have made significant gains, and I think it's important that we recognize as Kenyans the little that we have done has made a very big difference. If we had not done what we have done in terms of very early stopping the international flights, in terms of making sure that anybody who has been in contact with a victim is quarantined, in terms of making sure that water points are available everywhere for people to wash their hands. If we had not done that, we would be talking a very different story. And we don't need to go far. I mean, we just need to go to the other side of the Kenyan border, and you will see that the story there playing out is a very, very worrying one. And that is why His Excellency the President ensured that that border was closed, because we were seeing more and more Tanzanians showing and in fact being infected. So really, it's times like those that we must recognize that we have done well as a country, but it is not time to relent. It is not time to relax the measures.
And PS, we'll come back to the relationship, the movement within our borders or across our borders. But let's go back to the modeling, because you're saying that you are likely to reach a peak in October, and you're saying it's not perfect science. From my simple arithmetic, I don't think it's any science there, but I'm looking at since the month of May began until now, we have recorded or registered 491 cases. If you are to peak in October, then that may be about 4,910 cases, so nearly 5,000 more cases, and that now would take us to about 6,000 cases by that time. Is that the correct estimation? And if that happens, do you think we have the capacity to deal with the load that comes to the public institution, to the health facilities that we have in the country?
We are working with a very vast assumption. It is possible, and it is also possible that people will be more adherent, and that will help us to ensure that we are not hitting those numbers. But because again, that earlier predictions had said that by around this time we would have been at a certain point. But I think because of, and really it is not just because we know, because the measures we took helped us to stop the spread. So what I think we are going to then see for us to end this quickly, and remember that this COVID is hitting the economy hard, so it is to the interest of the government and every citizen that we go back to our normal lives as quickly as possible. So if we do very well, we could be hitting then under 4,000 by October, or even much less, because who says that we cannot begin to see the numbers going down? Especially now, we have gotten a better capacity for testing, because testing has been a challenge, and it has been a challenge that is beyond our control. It has been difficult to access testing kits out there. The whole world is looking for testing kits. So even when you place a significant order, you don't get everything at a go. We get, 8,000, then we hold on, we get another 10,000. So we have tried to diversify our sources of testing kits. And that in itself also, frustrates the process, because sometimes you want to test more than what is there. And, we hope that now that I think for the first time we have had the largest number of testing kits in the country. So we hope that in the next few weeks we will mop up more people and we will do much more mass targeted. And you know what we are doing here is not just mass testing, but mass targeted testing. So that if Isili is the problem, we will go in there and test people in Isili and try and mop out as many contacts as possible and place them in quarantine.
Right.
So if we continue in this way, who knows, the numbers could actually come down quite significantly. And if we all cooperate as citizens and stop trying to beat the system.
But PS, that might be sounding a bit ambitious, bearing in mind that with all these measures, with all the curfews, cessation of movement in 5 counties, we still continue to register new cases. You're talking about Eastleigh and the old town of Mombasa. We still continue to register new cases. I mean, what more can we do? Is it a chance that now people can just begin to lose hope because that sort of fatigue is already being registered across different parts of the country?
No, actually, for me, I would say this is not at all the time to lose hope. First, we must laud ourselves for being where we are. We have seen that there are countries that, have spiked, and, there are people who you can say are in a very bad place because of the numbers and because of late interventions. So when we look at how we have intervened quickly and how we have been able to contain, because you're aware there are countries that are reporting 800 cases a day, and we hope not to get there. So for me, I totally believe that there is hope. There is a lot of hope, and because let us also not lose sight of the fact that we have recoveries. There are people who are recovering from COVID. That's also a good sign for us.
Right.
So, and the mortality is not as high. We are losing, of course, what is now common is the more elderly people and those people who have other illnesses within them. So I would say let us not lose hope and in fact seize the opportunity that we have to change this trajectory, because it's all in our hands. And that's why, as I said, even for government now, we will buy masks. We will make sure every border person gets a mask. We will make sure that every person who is selling vegetables gets a mask. Because we also get concerned with the quality of, things that people use for masks. Because you've seen some people using, these paper bags that we use nowadays. We've seen people, just getting a piece of handkerchief and putting it on their nose. And we know that that continues to expose us and make us very vulnerable. So once we move very aggressively on that, and people continue without tiring, we can't tire. That's what I would like to tell Kenyans, wash your hands every minute you get into your compound, every minute you walk into a shop and you get out, wash your hands. You enter a public vehicle, wash hands. That we can't relent. But I think we have a lot of gains that we have made, and it is time for us to even tighten our belts. That's what I would say.
PS, it's interesting that you should question the quality of the masks that people have been using. And obviously, you're in the right place to do so, bearing in mind that people have been using what they can access, what's affordable, what's within reach. And you're saying that you'll be distributing to the border riders as well as persons that work at markets, I believe. How soon do you see the ministry being in a position to do that?
It has begun. It has begun. So far, through the Ministry of Interior, government has been able to distribute over 1 million masks, almost 1.2 million. And, it is still, of course, feels like a drop in the ocean, given our large population. So we will be moving again to hit that 5 million mark that we are starting off initially with. And and you understand the processes of budgeting. This is not a disease that has found us prepared. It found nobody prepared. We've all just found ourselves having to quickly reconfigure budgets, quickly look for mobilized resources. And so in that process now, we are at a point where we can go and engage various local institutions to be able to give people masks. So I would say it's just a question of time. Whoever was ready for Corona, nobody. The most you do is to be as responsive as you possibly can be. So yes, the quality that we see out there is worrying, but 1 million, we are trying and going. And of course, we also want to appreciate the political leaders and other religious leaders and other individuals, philanthropists, who have stepped up and bought proper reusable masks for their population. So if there's one thing we can also do for the other, buy somebody a mask if you can, before we get them to the people in the numbers that, you begin to feel a sense of comfort. But then again, I allowed some counties. There are counties that you'd go to and literally find everybody in the marketplace, everybody in shops wearing masks.
All right,
So
but
again,
PS,
there is that need at a local level to take full ownership and ensure that those masks are worn.
But PS, obviously Kenyans are lost at some point because the Kenya Bureau of Standards, I think it was early April, indicated that they don't have a standard for these masks. And therefore, people have been told that if you are found in the public place without wearing a mask, you'll be arrested. We're seeing some of them, what they're wearing. As you say, it's poor quality. Others are wearing them wrongly. Theirs is just to avoid being arrested. I mean, what do we do as at the ministry? What can you do to ensure that whatever people are using is protecting them against the virus, not just the police?
I think what we continue to do is to message. We continue to, ask Kenyans to do with what they can, because, before you get the right mask, even that simple measure of just using a folded piece of cloth and tying it around your mouth and nose makes a difference than having nothing. But of course, as we go along, as I said, we'll see more people being covered and getting the mask. Because the truth of the matter is, a lot of Kenyans are struggling. Lots of families are struggling. So to expect somebody to even spend that 50 shillings is not easy. And also remember, for cabs, this is the first time that they are having to come up with standards for a reusable mask. Whoever thought that that would become a requirement in a country and in the volumes that we need them? So I think, to give them credit, they have worked very hard with the Ministry of Health, and together we have been able to identify the kind of mask that can be used by a citizen and that can be reused even for up to 1 year and at an affordable price. So I think we've done well on that front. It is now just getting those masks in a significant number out there.
Okay, PS, let's talk about the testing regime that we have in the country. I know earlier on the government indicated that across the country we have a capacity to test up to 37,000. But then again, the effective capacity that time was way below 1,000. I think yesterday we saw above 2,000, maybe the first time. But also the numbers have been have been fluctuating. Sometimes you do more than 1,000, sometimes below 1,000. What is our actual effective capacity that we can comfortably test on a daily basis?
One of the facts about this whole situation is that it has been difficult for us to access some of these things. Simple things like just getting that swab collection, the sample collection kit, the swab that we use in the nose and the swab that we use in the mouth to pick the sample. It gets to a point where they become just difficult to find out there in the international markets, and different agencies of government try and pull together to get a hold of some of these things. The testing kits themselves, look at the kits that we are now using, Roche test kits. We've ordered for Abbott test kits, because we also want to ensure that we are getting test kits that will be, of a high quality, where we do not get errors, because in some countries you have seen what using, say, rapid test kits has done. People have assumed or gotten wrong indications on the test and have moved about the business, and unfortunately they had corona. So for us who are buying, good quality testing kits, you're getting them, say, for example, we've been relying from the United States of America, and the restrictions that they have imposed on exports, because they themselves are struggling with their own population in terms of testing. So we are also operating in a very, very tight global supply chain for some of these commodities. They don't come as quickly as we want. Sometimes even those test kits, I will tell you, you'll be told that the flights will be here by the next day. And now we have learned that until you see the test kits, then you have not seen them. But so what we have done now as government is we are now diversifying the sources from where we are buying. So we are also looking to the East, South Korea, and other countries that have got testing kits that our labs have validated. And so that is what we are hoping will see us have more and more testing kits to do more tests. So let's also accept that that has been a challenge, not unique to Kenya, but a global challenge. And really, it is what we have had to work with. Sometimes very limited supplies. But as I said, I don't think we have been at a better place than what we are at right now. All the laboratories have got the testing kits. They have got sufficient sample collection kits. So that's why for this week, we are looking forward to mop out as many contact traced individuals as possible. And possibly that would mean you'll see a bit of more numbers because we'll be doing a much more thorough testing. So those are the realities that we operate in, and every government is struggling with. It is not only Kenya.
Right.
There are very few companies that produce these things.
Okay.
So it is a constrained supply chain, but so far so good for this country. We have not had a day when we have not had a single test kit, but we have had days when the stocks can be fairly low, and our agents, wherever they are out there, our embassies are not asleep. They are also working hard to source these things. It takes that. It takes now a complete whole government approach to secure some of these things for the citizens of this country.
From your own estimates at the Ministry of Health, you had indicated that by June 2020 you would have tested 250,000. That would have meant that you were able to test about 3,000 on a daily basis. Now you have tested over 43,000. So you still have a balance of about 207,000. And for you now to meet the target, that would mean that you're able to test 4,600 every day. You, of course, currently are doing just about 2,000. Do you see it as a possibility? And secondly, you've been doing targeted mass testing. Would there come a time that you're able now to branch out to the larger population?
One, I think we have done well with what we have because, as I said, there have been constraints on getting some of these things. That is a fact. The beauty about our situation is that we are not we do not lack laboratories. In terms of lab capacity, the whole country, we can do 37,000 tests in a day comfortably. But remember, that comes with something at the back end. It means you have got enough health workers who are going to conduct all those samples and deliver them to the laboratories for testing. So on that front, we have gradually increased the numbers because since COVID started, if there is one thing that we have spent a lot of time in, and want to thank our partners, is training. Training our lab technicians, training the clinicians, training public health officers so that they can be able to take good quality samples. Because again, when the samples are not taken correctly, then you get a poor reading. So a lot of heavy capacity building, and it's ongoing. So, I mean, look at that, getting the right personnel. You remember even when we started, not all our labs had the capacity, because this is also a highly sort of specialized testing of its own. It's not your normal single test. So initially, you remember we started with 4 labs. We have now grown gradually. We have 20 laboratories that can test. So you can see that as we started, the limitations were there because it meant the whole country had to consolidate all the samples that are collected and send them to the 4 labs. So the fact that we now have more labs in the country, 20 laboratories, and we are continuing to expand because we already have them there. It's a question of sometimes reprogramming the equipment, and sometimes it is also the question of training people. So we are now at a better place, I would say, and
but obviously, PS...
We should see ourselves testing more people as we move along.
Obviously, PS will miss the target. Does that concern you?
Well, it would concern me, yes, but I also understand the realities that we all face. I mean, look at Ghana. You know, initially everybody was telling us, oh, Ghana is tested more than we have. And the last I checked, Ghana is just at about 50-something thousand right now. Initially, they were able to test more. And I can almost imagine and guess what happened to Ghana. They must have now gotten a limited supply of the test kits, and maybe that's why the numbers have gone down. So really, for us, I think we have been strategic enough to now diversify, as I said, where we are buying. Two, we have ensured very robust and aggressive training of the people who collect the sample collection kits. We have also increased the number of people who are contact tracing. And here I really want to appreciate those county governments that have been so proactive. They have, put out rapid response teams so that anytime there is a call of a case, they have been able to run within their county and pick the person and also pick whoever the person has been in contact with. So, I mean, we have built capacity as we have moved along. And that's why I keep saying, let us give ourselves some credit. We were never prepared, but we have been very responsive to this date. So I am not worried that we will not be able to manage more. I think we will, because the other thing you also must recognize, mobilizing resources is not an easy thing. We have to mobilize resources within the constitutional space. Budgets must go to the National Assembly. I mean, let us remember that we have to quickly sit with development partners to reprogram any funding that was directed to this country to turn it into COVID. That takes time. And so this is the point where a lot of those things are crystallizing, which means that our capacity to even get more testing kits, more sampling collection kits is increasing. I mean, look at the philanthropists even of this country that have come up. People are raising money. The COVID fund finally is hitting some substantial amounts. Equity Bank stood up the other day and gave some substantial resources. And I tell you, all that means something, because you can imagine the struggle for resources within government in a poorly performing economy. And it is not just COVID, the disease, that has got to be tackled by government. Government has got to increase its expenditures on just enforcement alone. You can see the entire police force is out there making sure that people stay within the guidelines. I mean, you can imagine the people who now cannot feed themselves. The government must look for money to buy food for people. I mean, when you think about the pressures on our exchequer, it's heavy. Then look at the tax reliefs that His Excellency the President has given. We have health workers who also we need to consider and give a welfare package. I mean, all this is significant resources, and within a time when you're not prepared. So I think now, giving it at least 2 months down the road, we are also at a better place in terms of the visibility of the kind of funding that is available to support the entire COVID response. And really, one of the things I must say, it's been very unfortunate that we have sometimes people have misconstrued that the government has gazillions of money. I think the fact of the matter is, one, taxes have gone down, and secondly, there are so many other things besides buying test kits. There are so many other things that the government has to pay attention to.
And
so
PS,
I think that's what I would say. And
PS,
so far,
if I may cut you short.
And we want to thank our partners who have
PS.
been equally responsive to redirect money into the COVID response.
PS, because you took me there, we have seen a story a few days ago that the Kenya Medical Research Institute is constrained of resources. The Daily was quoting a figure of 950 million shillings, but also we have a report from the Senate Ad hoc Committee on the coronavirus that it had indicated that KEMRI was lacking up to 790 million shillings. Part of it was going to hiring personnel, buying equipment and other affairs that go with COVID-19. What is the correct position? Because yes, 6 billion shillings has been advanced to the ministry, the Kenyan government in tackling COVID-19. How come that KEMRI is still struggling with resources?
Let me tell you, if there is one thing that is difficult at a national level is appropriating resources. Because when you look at 6 billion, it looks like a lot of money. But remember, it is from this 6 billion that we are having to recruit people. You're talking about $1 billion just gone like that. It is through this same money that you're buying test kits. You're buying laboratory consumables. You're looking at buying PPEs. It is the same resource that you're using to make sure that these teams that are working all over and 24 hours round the clock are properly taken care of. So when it comes to the actual institutional need, remember again, when we are talking about the money now, we are talking about the supplementary 2 budget that was done recently. Remember, by the time supplementary 2 is being done, the economy had already taken a hit. So even the ministry does not get its wish list. We all go with a wish list and we say we would like to support this. This sector is going to whatever is going to face a challenge, but we do our best, and really we appreciate the support of the National Assembly in being able to help us realign funds to the priority areas. But let us also be awake to the fact that we are operating under difficult circumstances. So for the sake of case of KEMRI, they are not the only state corporation under the Ministry of Health. We have got other state agencies, and not all of them got what they needed. But all I can say, as far as corona is concerned, KEMRI is properly facilitated to ensure that it undertakes its mandate, both in terms of supporting the testing and two, in terms of research.
How much money have they received so far?
Working hard to do some research.
You said that they are properly facilitated. How much money are we talking about that they have received?
We are talking about their budget. They have a budget that they have been allocated, like every other institution. I may not give you the correct figure right now, but I can tell you that from where we sit, they do have a budget. And as I said, when you're going into a budget-making process, the wish lists are many, and they come from many sectors. Remember, the tax collection has gone down. So we will not just rely on that, and that's why I mentioned to you that development partners also become very key, because we discuss with them to reprogram some projects away from what is not priority to what is priority now. So I am not too worried about the resources. Even if we are constrained at this point, they will continue to get resources. One of the areas where KEMRI had a bit of a problem is accessing some PPEs and some other several, basic things that they needed, and that has already been resolved. KEMSA has unlocked that and delivered it to them. So, but then there are some, I mean, if you go to KMTC now, you go to Kenyatta, they will still tell you, we wished to get 2 billion, but we're able to get 1 billion. That is how budgets go. So as a PS at the Ministry of Health, KEMRI is properly supported, and where there are gaps, we will just ask for, some patience, because we all know.
That's a bit of a contradiction. Allow me to cut you short. That's a bit of contradiction, because this report, it came out on the 13th. The report by the Senate committee came about towards the end of April. So are you saying they have already been allocated the money on paper, or they have received it?
So which money are we talking about? Are we talking about the PE?
The gap of 790 million shillings.
Which was meant for what purpose?
Okay, I can give you the figures, because according to the Senate report, the personnel hiring was supposed to cost 100 million shillings, financial support of 540 million shillings, the equipment was supposed to take 150 million shillings, and the total was coming to 790 million shillings. So when you said that they have been facilitated, have they received it? Go ahead.
What I can confirm to you, as we speak now, KEMSA is doing some promotions, and they have been granted approval to do the promotions, because part of the issues of human resources, when there's a bit of the organization has been recategorized and they have not aligned, and we have resolved that, and that is similar to what we had with Kenyatta last year. They had not attained their categorization level in terms of money, but the funds were provided. So on that front, because I know the board is sitting to look at that issue and interview candidates for promotion, I don't think that we have a concern. Then when it comes to these other amounts of money that they need, as I said, the gap, I can tell you, and take time to look at the budget, will not only be with KEMRI. It will be with every other institution. Every institution has its own gap. But what I know is that we are not at a place where KEMRI is at a standstill. KEMRI has money. If you look at the budget, they still have the allocation. But who doesn't have a gap in a budget? But the kind of gap that is there does not in any way compromise their capacity to undertake their activities. They are well capacitated. If you go there, you will find them testing. You will find them, doing what they do. You will find them doing their research. So really, sometimes the impression that is created by, a fact that there is a gap is that we are a standstill, and yet really that is not the case. And I can tell you, as an entire ministry, I think take the trouble to look at the budget for the Ministry of Health. You'll also find that there will be some gaps. There are things that may not be financed. And so what we have to do is to sit and make concessions which areas are important, which others can wait for a bit. It's just the way you do your house budget.
Right.
So, I mean, and we also have to be sensitive and alive to the fact that, I mean, look at the economy. What taxes are we collecting now under these circumstances? And that's why we must really get to the end of Corona as quickly as possible to normalize the country and to be able to have people back to work and have the tax revenues increase.
Right.
So really, yeah.
Yes, as we wind up, PS, you mentioned about correcting an impression, and at the start of this month, there was that impression that 1 billion shillings had been spent by the ministry. I saw a statement from you saying that that money was to be spent over a period of time. What is the correct position? Because Kenyans were really angry looking at some of the figures there, including some 4 million shillings that was to go to refreshments. Maybe you can just respond to that because we've not heard you on this matter.
Well, what I can say, number one, is to give assurance to Kenyans that we are doing our best to make sure that each shilling counts and pushes to the largest extent possible. What happened that time was very unfortunate because it picked out, a budget that had been proposed by a program, because that was a budget. That was not what would you call, like the statement of account. A statement of account means that you have expended this money. This was proposed by where somebody the officers and the project had said, this is how we would wish to do, to have the budget. And, on the matter of hospitality, and I'm sure when you have a team of people, 500 people who are working on a 24-hour basis, these people, of course, they are entitled to getting at least a cup of tea to keep them going. Right. But anyway, arising out of that, we discussed with the bank and agreed that, okay, let us now reduce that budget. And remember also, it was not a budget for a month. We are doing a budget for the next 6 months. So it was so unfortunate. And really, I think for us is to say that really we may have caused people to lose confidence in the way that the budget was projected, but I want to assure you that it was only a budget, and as you came to find out later, we have not even spent that money. We were in the negotiations with the World Bank on how the money will be utilized, and that is why you never heard the bank coming out and saying that, in fact, we are cutting the funding. If typically there is an issue of graft, any partner would pull out immediately. They realize that they are misdemeanors. But World Bank has stood with us. They understood what had happened. It was unfortunate that the budget came out in the way that it did, but it was just a budget. And
we need to end up on this.
We were able to clarify, and the members of parliament understood the position of the ministry. And so I really want to take the opportunity to assure Kenyans that we will ensure that we use any funds directed for COVID in the most prudent way, because we also appreciate the circumstances under which we are operating. And as I said, each shilling has to be stretched to do the most it can for Kenyans.
In a short answer, PS, as we wind up, you said that was reduced after negotiations with the bank from what to what?
I don't think I want to start that Pandora's box, because I will mention it, and the next thing, it is the thing doing the rounds. But what I can just say is that it has meant that we are looking at well-wishers to give tea to our staff. I'm in discussions with my colleague in the PS for tourism, asking her if she can urge some of the hotels to offer some meals for them, because these are people who even work at night.
Right.
They don't sleep. You don't sleep in COVID. We have an emergency operations center that, as I told you, works round the clock. So let me just say that thank you to the people who stepped in to support, and we have removed that impression, because we know it was very sensitive coming at a time such as now, when a lot of people are struggling to make ends meet. So I just would say thank you to the tourism sector for rising up to take up that load off us and make sure that our workers are well taken care of as they continue to do their work.
All right, PS, I wish you could give us the figure, but you said that you don't want to get into that because Kenyans knew that the tea and the snacks was to cost 4 million shillings. You don't want to give us the figure. Is that your final answer?
No, all I will say, no. I mean, all I will say in all fairness, because you know how we can get, is just to say that that was a budget. The budget was since reviewed, and it has been you know, we have changed that. And again, I mean, we did it because we also have to be sensitive. You know, that was an unfortunate, great, you know, misunderstanding. But it was a budget. It was nothing that was cast in stone. It's not something that I had even approved for expenditure yet. We were still in negotiations with the World Bank when the National Assembly called us to present the budget. And we said, this is a budget. And that's why they understood. It was not used. And, you know, even when we sit to do these budgets, you know, I sit there with officers saying, you know, we need fuel to move. The vehicles need fuel. We need this. We need that.
PS.
We need more stationery. You know, because it is a unique situation. And what we basically said, a lot of these things, let us look for other ways of supporting. Let this money focus more on the actual management of COVID. Although sometimes you wonder, where does it stop? Because the human resource behind the fight against COVID are part of COVID. But please be assured that that position was reviewed, and that was only a budget. It was not something under consideration and not money spent.
All right, PS, thank you so much for speaking to us on Daybreak this morning and to talk about the state of the war. Asante sana for joining Daybreak. Now, I want us to take a short break.